Hello, dear students and esteemed learners. Welcome to this course on Sociology of Health. This is our seventh lecture, and today I have included the topic Functional Perspective on Health, Illness, and Medicine. In the previous lecture, we talked about the biomedical perspective on health. Now, why do we need to talk about this functional perspective on health, illness, and medicine? This is a very important question, and I would like to answer this question first. In the previous lecture, we saw that the biomedical perspective is the dominating perspective, and it includes huge amount of research, technological inventions, medical practices, and specializations. However, there was also a critique of the biomedical perspective which emerged in mid of the 19th century, where it was stated that the biomedical perspective is focusing too much on the biological determinism. That was also considered as a reductionist approach. And that perspective was basically assuming or considering that even the psychological or environmental issues could be reduced to the biological issues, right? That is what is basically reductionism. They were not taking into consideration the psychological or social or environmental factors as the causative factors. However, because of the criticism which developed within and outside that, at a later stage, they accepted or included the social, psychological, and environmental factors as the determinants of the disease also. And overall, or gradually, a holistic approach developed. So now we would like to see that how the social determinant approach actually matured and what was the contribution of sociology or medical sociology in the development of or in the growth of the social determinants approach. So that is the larger perspective for which we are taking into consideration this topic. Now in this topic or in this lecture, I have included several subtopics like understanding the functional perspective, then identifying the main contributors like Emil Durkheim, Malinowski, Talcott Parsons, and talking about the criticism and the limitations also. Now, for understanding the contribution of the functional perspective, we need to understand the functional perspective first. There are many popular perspectives, and a perspective is basically a specific way to see, which includes the contribution or viewpoints of multiple people. So, this functional perspective basically includes the views expressed by good number of sociologists like Spencer, Durkheim, Malinowski, Radcliffe Brown, R.K. Merton, and Talcott Parsons, and many more. But those were basically the people who established the functional school of thought, and it was a dominant perspective in the US in the 20th century, basically first half of the 20th century. Now this perspective started with an analogy between the society and a biological organism. Just as the human body consists of different but interrelated and interdependent parts, similarly, the society consists of a number of different systems and subsystems. Just as every organ is necessary for the body, every part is necessary for the society. That means there is a kind of interrelatedness and interdependence among the parts of the society, just like what is happening in the human body or any biological organism. And if there is malfunctioning in one part, then the whole will get adversely affected by that. And it will be the need of the whole to get the part corrected at the earliest. So that kind of analogy is basically developed between human organism and society, and that is the core argument of the functional perspective. There are several other concepts, but it will not be fair to talk about all those things, but primarily we will focus on the arguments of the functionalist perspective in the context of health, illness, and medicine. So the functionalist perspective sees that the various parts of the society basically achieve a unity as they function to sustain the whole. So in a nutshell, you can understand that functionalist perspective says that society has multiple parts. Every part has a positive as well as negative contribution for the society, but the society encourages to make the positive contribution, and it is in the larger benefit of the society that the parts should sustainably contribute positively for the well-being of the society or for the maintenance of the society. This is the core argument of functionalist school. Therefore, functionalism is less concerned with the individual actions, rather with how these actions and beliefs function to maintain the system as a whole. That means how the parts contribute for the maintenance of the whole. That is the larger perspective within the functionalist perspective. The functionalist perspective is consensual approach to the understanding of society, which also assumes that the latent or hidden functions of everyday activities have significance for maintaining the system as a whole. Some of these statements are written in the slides also. You can read them. We need to identify the main contributors. As we stated earlier, at many places, Talcott Parsons is considered the most important contributor in the functionalist perspective. And Parsons made his contributions in the decade of 1950s, and that is why the decade of 1950s is considered very important basically in the history of sociology of health or medical sociology. Because Parsons, Talcott, in his book The Social System, talked about many concepts which had direct application for health, illness, and medical profession. In his contributions, Parsons did talk about the concept of sick role, then hospital as a social system or as a subsystem. He also talks about the physicians or the doctors as gatekeepers of the health or sickness behavior. So there are so many other things. We will talk about these things. But before actually talking about these things at length, we need to identify, is there any other functional sociologist or any other sociologist who contributed in the functional perspective who did talk about health, illness, or disease before Parsons. And then Cookerham has tried to identify those sociologists, and he finds that Durkheim and Malinowski did make such contributions. So we will talk about Durkheim and Malinowski also very briefly. French sociologist Emile Durkheim is often considered as one of the classical sociologists. He is known for his theories of social solidarity, suicide, division of labor, and social facts. Now, Durkheim's theory of suicide, all students of sociology would be familiar with Durkheim's theory of suicide, but here we are making only a brief reference. So, Durkheim's theory of suicide talks about the act of taking one's life was determined by the individual's ties to his or her community or society. That means he talks about suicide in the context of the social determinants, which is basically the tie of the individual with his or her community or society. This is seen in his typology of three major types of causes of suicide. Egoistic suicide, which is primarily caused because of social detachment, anomic suicide caused because of a state of normlessness, and altruistic suicide caused because of a normative demand for suicide, or you can say that the social attachment kind of thing. Thus, Durkheim tried to see death, that is suicide, caused by social factors, and thus established a thinking which ultimately developed in the form of social determinants of mortality and morbidity. So, this contribution did play an important role. Then we talk about Malinowski. Malinowski talked about culture in a very comprehensive way, and when we study his concept of culture, we find that the notion of health is embedded in his concept of culture. Malinowski saw those problems as human needs that promoted cultural responses. These needs were metabolism, reproduction, bodily comforts, safety, movement, growth, and health. However, in his view, health is implied in all the other six human needs in addition to the need for relief or removal of sickness or pathological conditions. The summary of the argument is this, that Malinowski talked about culture, he talked about human needs, and he identified several mechanisms, processes, or states which are directly associated with health, help in developing the notion of culture. He proposed hygiene as the cultural response to health. So, hygiene and sanitation, etc., became very important in the domain of health that we all are aware of. So, if we can establish that Malinowski in his contribution and his concept of culture did talk about some of these concepts, then we can understand that Malinowski did talk about health and several other related concepts in his concept of culture and human needs. So that way we can identify Malinowski's contribution in the domain of health and illness also. But as we stated earlier, the main contribution was made by Talcott Parsons. Now we will try to see how Parsons made, what kind of contribution primarily Parsons made. Parsons' contribution in the domains of illness, sickness, medical profession, and health is considered the first contribution by major sociologists in the domain of medical sociology and sociology of health. Then, Parsons' contribution contends that health and illness reflect the level of social normality rather than physical normality characterizing an individual. Now, what does we understand by this? So basically, Parsons tried to see health and illness not just as an individual phenomenon, but basically as a social phenomenon. And he considered health as a social normality. That means as a requirement of the society. And that is why he is considering sickness or illness as a kind of social abnormality. So that is an important departure. Because the biomedical approach, as we stated earlier, primarily focused on the individual. And because there was a biological determinism approach, so the individual was considered responsible for the causation of the disease, and disease as a phenomenon was not seen at the societal level, rather at the level of the individual. Now, Parsons made a huge contribution in this particular context, that disease or illness and health needs to be seen at the larger societal level. So, sickness is viewed as a form of deviant behavior that must be controlled by the society. So, when health is considered as a social requirement which is necessary for the sustenance of the society, then sickness will certainly become a distraction or a deviance. So Parsons considered sickness as a distraction, as a deviant behavior. Now, when there is a deviant behavior, then it would be the responsibility of the society to make a correction there. So if sickness is considered as a deviant behavior, then it will be in the good health of the society to get that deviant behavior corrected. That means get that sickness corrected. Now this is a very important contribution. The sick role is a shared set of cultural norms that legitimates deviant behavior caused by the illness and channels the individuals into the healthcare system. Now, again, this is very important. Parsons says that when an individual is becoming sick, then actually he has entered into a new role. That role is identified as a sick role. Now, what is very important here, that how does society respond to this new role of the sick role? Parsons here says that the society basically legitimates the deviant behavior caused by the illness. That means when a person is becoming sick or ill, then he is not in a position to perform his normal duties. So that is basically a kind of deviance. Now that deviance is basically considered as legitimate. Why? Because the person is not well. And at the same time, the society creates a mechanism or a system, channelizes a system by which that person will come back to a normal health condition so that that deviance could be corrected. And a very important point is also highlighted in the last statement. The sick role is shared set of cultural norms that legitimates deviant behavior caused by the illness and channels the individual into the healthcare system. So that channeling of the individual to the healthcare system is very important. So the notion of sick role not only legitimizes the deviance caused because of the illness, but it also channelizes the individual to the healthcare system, and these are considered as very important contributions by Parsons because these talk about the larger healthcare system and how and why the person who is not well or who is sick is in need of a healthcare system. Now, Parsons' theory talks about multiple things. We cannot talk about all the points here within this limited time span. So, we'll talk about 4 important points which have been highlighted by Tischler. The sick person is excused from normal social roles, responsibilities, except to the extent that he or she is supposed to do whatever is necessary to get well. There are 2 important things. First, the moment a person is declared as a sick person, he gets a kind of relaxation from his normal duties, right? In normal situation, we all are required to fulfill our normal duties. But once someone is becoming sick, then there is a relaxation. That is first part. And the second part is this, that he or she is supposed to do whatever is necessary to get well. That means the person who is not well, although he is getting a relaxation, but he or she is supposed to do whatever he or she can do for getting well, because that relaxation is meant for getting well, for ensuring or getting involved in the things which will make him well again. The second point is this, the sick person is not held responsible for his or her condition and is not expected to recover by an act of will. Now, this is again very important. And if you see the implication of this statement for the larger society, then this will become even more important. Now, the biomedical approach, primarily because of the biological determinism, held the individual responsible for the illness or the sickness. And so the individual was blamed for that. Now, according to this concept of sick role, the person cannot be blamed or cannot be held responsible. Why? Because whatever has happened, it has happened because of the larger environment. Because the functional perspective looks at the things from the larger environment perspective. The action of the individual is not given that much importance in the functional perspective, and the importance of the larger environment is basically the dominating or primary. So this way, if somebody is not feeling well or becoming sick, then he or she is not responsible as such, but we can identify the causation at a larger level, that is at the societal level. So this is again very important. The third point is the sick person must recognize that being ill is undesirable and must want to recover. Now, this is again a very important point, that although being sick is acceptable but undesirable for the society, because a society cannot survive or sustain if the members are sick. So it is not in the larger benefit of the society to have a sick member. And so it will be the responsibility of the sick person to do whatever he or she can do for getting well soon or for the recovery. That means it makes the individual morally committed for taking the steps for recovery or for getting some kind of healthcare intervention. And the fourth point, the sick person is obligated to seek medical care and cooperate with the advice of the designated experts, notably the physicians. Now, again, there are two important ideas here. First, the sick person is obligated to seek medical care. So it is not something, the individual is not having the liberty of whether to go to the medical expert or not. Rather, the individual is supposed to go. The individual is supposed to go to the expert for medical care, because getting recovered from that state of illness or sickness is desirable. So that is the first part. And the second part is very important. The advice of the designated experts or the notably or the physicians need to be followed. Now it would be required from the sick person to follow the advice of the medical experts. That is also required from the sick person, and the concept of sick role is talking about all these conditions. In this sense, although the sick people are not to be blamed for their illness, they must work towards regaining their health. So we can summarize. Parsons believed that illness is dysfunctional for both individual and the larger society. Next, it is important for the society to maintain social control over the people who enter into sick role. Some kind of control is basically maintained so that people should try to recover and not many people should become ill, right? Then physicians become very important, because when people basically go for healthcare, then the physicians will come into the picture, because they will take care of the health needs of the people. Now, physicians were considered very important because they are the people who will make contribution in the specific direction so that the sick people will get recovered. So physicians are empowered to determine who may enter this role and when patients are ready to exit it. That means the physicians will decide who is a sick person. So a person cannot on his own enter into the role of a sick role without a verification or confirmation from a physician. So the physicians are empowered to determine who may enter this role. And the next one, when patients are ready to exit it. So when it will be determined by the physicians again that the person has recovered from his or her sickness. That means entry into the role of sickness and exit from the role of sickness both will be decided by the physicians according to this Parsonian perspective, and that is why the physicians or the doctors are often considered or identified as gatekeepers of the sick role. When patients seek the advice of a physician, they enter into the patient-physician relationship which does not contain equal power for both parties. So when there is a doctor and a patient, then definitely the doctor or the physician is more empowered and the patient is not that much empowered. The patient is expected to follow the doctor's order by adhering to a treatment regime, recovering from malady, and returning to a normal routine as soon as possible. On the other hand, when patients arrive at the medical encounter, they are expected to surrender their medical knowledge and be guided by the medical experts. Now, this is again a very important point here. There is a concept of medical encounter. I will not get into the details of that, but basically when people face the medical professionals after becoming sick, then this situation could be identified as medical encounter, and here they are expected to surrender their medical knowledge. That means a person after becoming sick will not be entitled to take care of his or her own health requirements on their own. They are expected to surrender their medical knowledge, and then they are supposed to get guided by the medical experts. This statement shows that how empowered or powerful the doctors or the physicians or the medical professionals are in this framework prepared by Talcott Parsons. Thus, according to the functionalist perspective, the sick role exempts the patients from routine activities for a period of time and assumes that the individual will seek appropriate medical attention and get well as soon as possible. Now we come to the last part, which is criticism and limitations. The functional perspective mainly proposed by Parsons was criticized. Now there are criticism at two levels. First, the functional perspective in itself was criticized by Marxist and several other perspectives. And the second thing is this, that the functional perspective on health and illness was also criticized. So we have included criticism at both these levels. I've mentioned the detailed arguments here. You can have a look on these. Many analysts believe that the sick role model does not take into account racial, ethnic, class, and gender variations in the ways that people view illness and interpret this role. Now, we have been saying that the social situations are very different and there are social determinants. But when Parsons talks about sick role, then he is assuming that there is a similar environment for all people, which is actually going against the idea of the sociologist as such. So there is a huge criticism on this particular statement. And then in relation to the sick role, for example, it has been suggested that Parsons overlooked the potential for conflict between patient and the practitioner. When Parsons is talking about the role of the physicians, he is assuming a very cooperative and collaborative relation. But in practical life, we see that there can be often conflicting relations also. And the Marxist sociologists have talked about the conflict of interest in terms of the finances and the profits involved. So it will not be technically correct to assume that all such relations are basically very healthy relations. Sometimes there would be conflict of interest also. And then Parsons is often stated to be more theoretical than empirical. However, Parsons' description was most relevant to acute illnesses and not the increasingly prevalent chronic illnesses and disabilities that would entail a permanent role status. So when Parsons talks about sick role, then he is generally assuming that those types of illness which are for short period of time, But when the person is sick for a longer period of time because of chronic illness, then the situation will be very different. And then there are several other criticism like the capitalist mode of production, which is basically argued by the Marxist about illness and disease, right? So these are some of the criticism and limitations of the functionalist perspective on sociology of health and medicine. However, there are two, three very important contributions that we must understand because those helped a lot in the growth of the biomedical system and basically the health system in the 20th century as such. What are those two, three important contributions? One, disease as a social rather than physical abnormality. So, this is very important that disease is basically a social concern and it will be the requirement for the society to get rid from all types of disease or illness. Then, main contribution lies in the fact that health and healthcare is the responsibility of the society and rejection of blame the individual kind of mindset. And finally, it necessitates positive action by society for identification of sick role and going back to the state of health. So with this, we have concluded this session. Here are the list of references and recommended readings. And here is a think about this, an activity question. Can you count all positive contributions of a health system? So a health system has several positive contributions, but can you count? Think over that. And then an activity question. Explain the relevance of Parsons' concept of sick role in contemporary society. So Parsons did talk about sick role in 1950s, but as of today, the situation is very different and we all are living in a society which can be identified as post-COVID-19 society. So in this context, can you make use of Parsons' concept of sick role? Try to answer this question. So thank you very much for being with me and we will meet in the next lecture. So till then, take care.